name is Amanda Schmidt, and I am a physical therapist, and I spent many years in direct practice at JPS Health Network. I am currently the area director for business development for Civitas. We are here today at the Harvest of Roanoke, which is one of our beautiful communities in DFW area. I'm here with Ryman Peters, the owner of Modern Acupuncture here in Keller, and we are going to discuss pain. So our wellness topic this month focuses on pain. Just a little bit about myself, and then I'll have Ryman talk about the services that he provides in his clinic. So like I said, I'm a physical therapist, and the reason that I believe in modern acupuncture or acupuncture in general, or alternative treatment methods, is because as a therapist, I saw many hundreds of people with the diagnosis of chronic pain. In 2016, laws changed that prohibited certain pain medications to be used. And so many people were being forced to either completely stop their pain medications or drastically reduce their prescription use of them, which then flooded my clinic with people with prescriptions that said, evaluate and treat for chronic pain. So here I am as a physical therapist. My job is exercise, stretching, some soft tissue work, things like that. And suddenly my clinic is filled with people that most of the time didn't even really tolerate me touching them or even doing a full evaluation. Let me look at your range. Let me look at your strength. They were in too much pain to even raise their arm up all the way, or let me test their strength, which then made me aware of the fact that what had happened is that these people's pain was now centralized, meaning that the brain was controlling the pain. This was no longer just a physical manifestation of the pain, meaning something happened here and it hurts. This is now my brain is telling me that my arm hurts even though there's nothing wrong with my arm. So I knew that my work needed to start in causing a shift in the mind. Well, exercise, yes, of course, it changes hormones and things like that, and that's why it's important. But when we're faced with people who cannot tolerate exercise or stretching because of pain, we have to look into alternative approaches. So what I found is I started recommending things like acupuncture, yoga, meditation, cryotherapy, heat therapy, getting outside, pet therapy, getting in the sun, things like that. So my home exercise programs would be sit outside in the sun for 20 minutes a day, call a friend that you haven't spoken to, but that you want to speak to, reconnect with your spirituality, your church, things like that. Try acupuncture, try cryotherapy. And what I found is that once we started shifting the mind's perception of the pain, then we could start exercise and the formal physical therapy treatment. So I was lucky enough to run into Ryman at a networking event, and he was talking about the use of acupuncture in our senior population, which of course I love because I've seen it work with countless patients when they take an alternative approach, especially when it comes to chronic pain. So I'll stop talking and I will let Ryman introduce himself.
All right. Well, as she said, I'm Ryman Peters. I'm the owner of Modern Acupuncture. We're located over in Alliance Town Center. And we are very passionate about our patients, about helping people. Our mission statement actually is making lives better. And we have had the opportunity, we've been there almost 5 years. We've seen hundreds and hundreds of people's lives get better. One of the things that I'm on a personal mission about with acupuncture is just explaining what it is. There's just a lack of information in this part of the United States on what it is. And most people don't realize it's a minimum of a master's or a doctorate degree in Chinese and Oriental medicine. All of our acupuncturists do have to be board certified by the Texas Medical Board, and they also have to be licensed herbalists in the state of Texas. So all of my acupuncturists are board certified. You do have to be careful when selecting an acupuncturist because there are people out there that are not supposed to be practicing. So that's an important thing to note. And we do see people that have gone to some of those people and say, well, it doesn't work or whatever. But when you go to somebody that is trained, then you will see the results that you're supposed to see. Acupuncture is literally focused blood flow. So as we were talking about for pain, literally what it does, it's opening up the blood vessels to the area where the pain is. So let's say it's rheumatoid arthritis. We've seen huge results in rheumatoid arthritis. It's literally reducing the inflammation, it's promoting healing, but it's also promoting the blood flow to the part of the brain that is receiving the pain. It's allowing your endorphins, the natural pain blockers, to flow to where they're supposed to do, the way that used to work when we were kids.
Right.
So, and another one I was thinking about as you were talking was phantom pain. We've been seeing a lot of phantom pain. We have two patients in particular right now. We have one lady, she's dealt with it for a couple of years now. She's an amputee just above the knee, and that amputation was done 20, 30 years ago, but she started having phantom pain and she doesn't have it anymore. So now she's working on some other things.
Right. And that's scientifically proven that alternative treatments help phantom pain. It's not medication. It's not exercise, my realm, physical therapy, because of course, as a therapist, I saw many amputees, but when we had that phantom pain present, we had to do visualization, mirror therapy. So I can definitely see how acupuncture can help with phantom limb pain.
Yes.
What about like acute pain?
So acute pain, we do see a lot of that as well. In fact, one of the things that we'll get is somebody will wake up with sciatica. We see lots of that, and it's like, well, I was fine yesterday, and then this morning I got out of bed and I can't walk.
Yeah.
And so typically, if it's acute, typically the quicker they get in, the quicker it goes away. I actually was one of those people. I woke up, I was walking up my stairs one night and I noticed that I felt like I had a little catch in my leg, and the next morning, same thing, I'm walking like Igor. I got out of bed, I'm hobbling, and so I got in. By that night, I was fine again.
Wow.
But we have seen people too that, where they've had it, for weeks or even months. And so the longer they've had it, the more treatments it's going to take to get rid of it, but you can get rid of it. So.
Right. So the focused blood flow, what it does is it allows the body to naturally heal itself, because we're increasing blood flow to the area. And a lot of times so let's talk about just the types of pain. So acute pain is, ouch, something just happened, or I woke up and my back is killing me, meaning it's a week old, a few days old. It's something that just happened. So sometimes there's an inflammatory response. The body sends healing agents to the area and to help heal. Well, what happens is when it doesn't heal, it then becomes chronic. So we're saying that this increased blood flow to the area through acupuncture can help acute pain, but also if it's not addressed and we're going into the chronic phase, this now is definitely when tendons, ligaments, muscles, all of those things have now restricted blood flow. We're talking pain that's going on longer than 2 weeks, which is crazy because a lot of people think their 2-week-old pain is acute pain, and it's not actually. That's now chronic pain. And the thing with chronic pain is it can segue into central pain, meaning it's not actually the shoulder that's causing the pain. It's the brain sending a signal that your shoulder is hurting. Whether there's actually something going on there or not, let's say it was completely healed, a shift can happen where your brain is still signaling that your shoulder is hurting even though it's not. But there again, that's where acupuncture can come in and kind of helps with, talk about that a little bit, the rewiring sort of.
Well, and that is basically... kind of going back to what I was saying earlier, it's just basically sending the blood flow to the nerves, to the site itself, to the brain, and it is actually improving the communication between those two. It's just resetting everything, getting it back to homeostasis.
Yeah, exactly. And then talk a little bit about another type of pain, which is a neuropathic pain. So a lot of diabetics will have neuropathic pain. Some people, even if you're not diabetic, may. So the nerves are wrapped in blood vessels, and they're teeny tiny blood vessels. So if any vessel is going to get damaged, it's usually the vessels around nerves, which is why as we age, we can't feel that our balance gets impaired. We fall more, things like that, because of that restricted blood flow around the nerves that cause our muscles to fire. So what examples can you give, or what can you say about neuropathic pain?
So we do see a lot of people with neuropathy, particularly in their feet. And we have a patient in particular that's been coming in. He's had neuropathy. He's tried things. It hasn't worked. The acupuncture has helped. It has taken away that pain. But the other side effect is his hemoglobin A1C has improved.
Oh, wow.
Yeah, he's been on just about, he has type 2 diabetes. He's been on just about every oral med that there is in combinations. He's even had to do insulin for a little bit. He had to do that, but Now his hemoglobin A1C, it's not 100% at goal, but it's the closest to goal that it's been. So we're still anxiously watching him to see where he goes. But and we've seen that with other patients. It's just helped maintain not only the hemoglobin A1Cs, but even the blood pressure that goes along with all that. So
wow, that's amazing. It was something I know that I used to counsel my patients in, is that the thing with God-given medication and pharmaceuticals and things like that, because they are needed. But the thing with medication and pharmaceuticals is they always have to be altered and changed. There's never one fix-it pill for your entire life. Either the effectiveness decreases, or it just doesn't work anymore. Your body changes, because as we age, our bodies change throughout our entire life. So I think looking into the non-pharmacological treatments of various things like diabetes, obviously acupuncture has improved A1C in this individual. What other types of diagnoses or chronic illnesses have you seen an improvement in?
Well, so I know I mentioned blood pressure. There's a patient that came in particular, chronic smoker, high blood pressure, same thing. He's been on calcium channel blockers, beta blockers, diuretics, you name it. Couldn't put down the cigarettes. The acupuncture actually helped. It's very effective for helping with that. But not only that, before he even quit smoking, we actually were able to get his blood pressure to goal. 20-point drop, both systolically and diastolically.
Wow.
And that was with his other meds. He's being titrated. His doctor, of course, is doing it, but they're titrating him basically off of his meds. They're at least being able to lower the doses. So
you've seen it help even with addictive patterns, addiction. Yes. I mean, because smoking is that. There's plenty of things that are addicting. You know, food sometimes is an addiction. Coffee. You know, all of us have something in our lives that we wish we could stop. Like for me, coffee, right? I would love, not to drink less coffee. And so acupuncture can kind of help with those patterns too.
Yes. And the way that it does it, the acupuncturists, in their questioning, they ask the patient before they start, they're really trying to figure out what's that trigger, what's causing it. Is it stress related? Is it, what is it? And a lot of times that they will go after that. So there's a lot of philosophy behind acupuncture. So it's going after not just the symptoms, it's treating the symptoms typically by going after the root cause of what's causing it. So with weight loss, with smoking addiction, alcoholism, it's really kind of figuring out what is causing the trigger for the patient to crave that, to go after that, and can kind of help with that.
At the end of the day, I think it's really crazy how hormones and your chemical balances, your electrolytes, things like that play the role in pain modulation, addiction, disease patterns, your happiness, everything. It really starts with a chemical balance in your brain, and your ability to heal. So I recently started acupuncture. I have been recommending it for years. Like I said, I've just never actually done it myself. And so I finally, after meeting Ryman, I said, you know what, I'm going to do it because I believe in it. I know it works. I've seen it work in plenty of people, but I'll try it because I've got this tendonitis in my elbow that will not go away. I've done all my own treatment techniques, everything like that. And it's just, it's very chronic at this point. And so I knew that I needed increased blood flow. But what I've noticed through acupuncture is an improvement in digestion, an improvement in pain in other areas of my body. My husband even commented on my ability to handle stress. He was like, wow, I'm actually impressed with how I had a really stressful day. And so he was kind of bracing himself, and he's like, yeah, you're doing really well with your stress management. I'm like, I think it's the acupuncture, because when the acupuncturist puts the needles in, she tells you what it's for. And it's funny how they pick up on things that maybe you didn't even say just by looking at probably your breath pattern, the way you're sitting, those nonverbal forms of communication. So there's many things that it can help, but in particular, with seniors, let's talk about the RA example, the rheumatoid arthritis example that you have. How have you seen that help with rheumatoid arthritis and the pain associated with that?
Well, my favorite example of that is a 52-year-old woman that came in. She used to be a pilot. She was a pilot, and she had lost her pilot's license because her rheumatoid arthritis was so bad. She was literally slumped over like this. Instead of standing up like this, she was like this. And she just walked into the clinic one day and she saw the sign and just asked, does acupuncture work for rheumatoid arthritis? Yes, it does. So our acupuncturist put her on a pretty rigorous plan for the beginning. They put her on 3 to 4 sessions a week. And she came. And after 2 months of coming, she was standing up straight. She was playing tennis. She was doing yoga. And the part that I left out was she was scheduled for back surgery. She never had to have that back surgery.
Wow.
And she got her pilot's license back.
Well, that's amazing. It really can give somebody their life back.
Yes.
I think any approach, any non-pharmacological approach is worth a shot. That's what I used to always tell, my patients would say, do you think I should try the chiropractor? And of course, sometimes, every now and then I might say no, but most of the time I would say, especially with chronic pain, it's worth a shot. Should I try Yeah, it's worth a shot. Why not? Because it really could be an answer,
yes.
Especially when, like I said, when we're looking at medications and things like that, that never is the definitive answer, unfortunately. They do have to be modulated, where acupuncture helps modulate and restore homeostasis, like you said, which is what we want. I think, so as far as pain in seniors, how have you seen how it affects a younger individual differently from like an older individual coming into your clinic?
That's a great question. The younger individuals, a lot of times they'll see a much quicker response, just because they're still young, their immune systems are still strong, things like that. With the elderly, I've seen it go both ways. I've seen where they'll have a very rapid response, or at least they'll notice a very rapid difference. And then others, it depends. They may have had this ailment for 20 years. And so, so in that case, it does take, going back to the rewiring, it takes a lot longer to rewire it. But most of the times they will see something pretty quickly. And part of one of the things that I see in that, and I think part of the mechanism that helps with this, is one of the positive side effects of acupuncture is sleep.
Right.
And which is partially what I use it for, sleep and stress. But when you're sleeping, the body's healing.
Yes.
So we do see a lot of that.
Yes, and that is proven time and time again that your body heals when you sleep. That is something else, is the importance of a good night's sleep, because that is when your body restores and repairs. It is the only time, really, because throughout the day you're using it and abusing it, and then at night is the one opportunity that it can go and patch things up. And then with acupuncture, it can help with the sleep. I've noticed that too. And not just help you fall asleep, but help you stay asleep, which is the important part. Because some people say, oh, I was, in bed for 8 hours. Well, how many times did you get up? How many times was your sleep interrupted? Where it's that continuous sleep that we're looking for, that deep sleep. And that's when the body can it scientifically does repair itself in those moments. As far as various alternative approaches, what are the options that I named several, but what are other options that people have to manage their pain?
Well, so, and not to just stick on acupuncture, but acupuncture is great to be integrated into whatever. So as you were talking about the chiropractic, pain management specialists, we've actually had a few pain management specialists that have started referring people into the clinic or to other acupuncturists. Acupuncture is very good for pre-op and post-op. And one of the things that we see with the pre-op is it helps to get the immune system ready. Because every time they poke you with a needle, you're starting to make those white blood cells. Your body thinks I'm getting invaded, so the little army starts coming out to fight. But it's also helping again with preventing the pain before the surgery. So once the surgery is done, then with the post-op, once the patient is able to come back in, or if you have an acupuncturist that's visiting them at home or in the facility or wherever, the acupuncture does help to continue to fight the pain and promote the healing. In fact, when I was looking into acupuncture, I didn't know much about it, and I started reading these medical journals. And there was a journal that had a head-to-head study of acupuncture and traditional pain medicines post total knee replacement. And so, previous to the surgery, some patients were having treatments, and then post-surgery, they were having treatments. What they found at the end of the study was the acupuncture worked just as well as the pain meds for the pain, and they had no other pain meds, just the acupuncture. But the surprise ending was the acupuncture group healed quicker because the blood flow was going not only to the site of the surgery, but also to the part of the brain that was receiving the pain and allowing the endorphins to get where they were supposed to go.
And then you guys also work hand in hand with physical therapists.
Yes.
So many of our communities have outpatient physical therapy on site to help with that continuum of care. So post-hip, post-knee, post-stroke, or just I have this chronic back pain. That's when a person could seek outpatient physical therapy. But like I was faced, sometimes that person sits down and their pain is not managed well. And so you have worked with therapists who have recommended acupuncture as well, improve pain management, then we can move forward with what we're doing in therapy.
Yes, absolutely.
So you work hand in hand with all the alternative approaches, whether it's yoga, whether it's meditation, whether it's breath practice. All of those things help that mind shift and help rebalance homeostasis and the chemicals within our body, which ultimately control everything. So let's talk just for a second about pain management and quality of life. So what can you say about that?
Well, when you don't feel good, you're not enjoying life like you should.
Exactly.
So certainly when the pain is gone, or at least controlled, you're going to sleep better. You're going to wake up feeling better. You're going to be able to enjoy life. So as I said, our mission is to make your life better, and that's what we do.
Yeah, that's 100% correct. Pain is inevitable. All of us have it. All of us will have it throughout our entire lives. And when you're hurting, you are not the best, quote, version of yourself. And I think especially as we age, for me, as I'm getting older, I'm noticing like I don't want a day wasted in pain, in horrible pain. I want to get on top of that so that I can live every day to its fullest.
Yeah, me too. and I like to sleep, and when you hurt, you don't sleep.
Oh, yeah.
So when I sleep, don't mess with my sleep.
Right, exactly.
Going back to one thing that we were talking about and kind of dovetailing in again with the healing process. So for me personally, I use acupuncture for a couple things. I use it for migraines.
Migraines, we didn't touch on that yet.
Yeah, so that's certainly a huge problem, can be. I used to have a lot of migraines. I hardly have them at all anymore, but I've literally had migraines stopped in their tracks. Where they've literally gotten me into the treatment room, found my pain points literally on the sides of my feet. I put the points in there. The pain was gone in 20 minutes. I still had the migraine hangover, but the pain was gone, so I was able to recover quicker.
Wow.
But now the frequency of the migraines has been cut down. In fact, I haven't had one in a year.
Wow. That's life-changing. Because migraines will halt everything.
They do. And for me, a lot of times when I have one day, the next day's messed up too. I just don't have any energy. I feel bad. But I have not had that problem anymore.
Wow.
And then the other main thing, which is probably what has triggered the migraines, is sleep and stress, which obviously go hand in hand. So for me, now my melatonin gets where it needs to go. So I fall asleep, which I could always do that. But then I would wake up in the middle of the night thinking about work-related things, or the weeds in my backyard, or a dripping faucet I need to fix, something weird that I'm not going to tackle at 3 a.m. in the morning. I don't have that problem anymore either. My serotonin and my dopamine flow to where they're supposed to go. So now I do get a good night's rest. I do sleep. I do heal. And again, the migraines have just pretty much all but disappeared.
Wow. Any other chronic conditions? So we've talked about CHF pretty much. I mean, essentially with the smoker, probably had a version of CHF in there. We've talked about rheumatoid arthritis. I'm sure horrible osteoarthritis you've seen, pre-op, post-op, migraines. Any other big one?
Well, touching on the osteoarthritis, so yes, we do see quite a bit of that. So obviously the acupuncture is not going to fix the damage that's already there.
Right.
But it can slow down or possibly prevent the progression of osteoarthritis.
Yeah, increasing blood flow to that arthritic area that is just a desert is how I describe it. So when you've got your articular surfaces and they're just dry. And that's when people will say it's bone on bone pain. It feels like bone on bone because there's no lubrication in there anymore because of the arthritic changes. But we know, and that's, part of the realm of physical therapy too, that motion is lotion and increasing increasing blood flow helps lubricate. That's the only thing you can do to help lubricate those surfaces. So I can definitely see how that's beneficial.
Yes, very. So there are still things that we still get phone calls for that I'm like, well, I'm not sure. Let me check with the acupuncturist.
Yeah.
So they've done a good job of training me so I can go out and have these conversations and just spread the word about what it is. It's a real thing. It's been around almost 3,000 years.
Yeah.
And there's a reason.
Well, that is very cool. Well, thank you so much, Ryman. I appreciate all of your knowledge. I appreciate the fact that you are working with assisted living communities and seniors to help reduce pain, which is something that not everybody may think of acupuncture as an option, but I definitely am a believer in alternative approaches. And certainly now that I've been getting treatment and had some pain-free days in my elbow because of acupuncture, I'm certainly a believer. And I hope that this can be just another tool in your life tool bag that you can pull out for yourself, for a family member, for a friend, for a patient, for a resident, when you identify somebody struggling and traditional approaches or pharmaceutical methods are not working. So once again, thank you so much, Ryman. And I hope you guys enjoy this discussion on pain, and you guys have a great day. Thank you so much.